you and Noreen were young. I mean, you're going to be married. You're going to be doctors. Um, was it just the money that you said we're going to add this? We're going to be Mr. and Mrs. Doctor during the day and do real health care, and then at night we're going to get a little thing on the side going.
Oh, yeah. Well, it's done for the money. I mean, if someone would have come to me, one of those faculty members or one of my fellow residents says, come join me for a free abortion clinic, a charity for the community.
Okay.
Well, I said, oh, I'm going to be there. Oh,
I want to serve
give
women.
me a break. Come on now. You think I'd go to the charity abortion clinic? Of course not. There is no such thing. Abortion is fueled by money. If the money variable in the abortion cartel's differential equation were removed, we would not be doing this podcast and there wouldn't be a 40 Days for Life. This is about the money. It's about cash. They don't have to file for insurance. You're dealing with a desperate customer who wants the product done. They want to get rid of it, either a desperate customer or a person who's forcing that woman to go through that, because we've talked about this before. It's not normal for a woman to want to harm their child. They aren't designed physiologically like that. That's just something that God did not design them for. So it's a business that they've gotten away with being, they don't really care about women. They want to get them out of the facility as fast as possible. That's what I wanted to do. I wanted to get to that facility, do as many or whatever number they had, and I'm going to get in my car and get it started, and I'm going to get the heck out of there until I have to come back again. And no, I'd never have heard of a charity or free abortion facility, and you're not going to hear about one.
So on that note, there's a talking point, of course, that abortion is a matter between a woman and her doctor. And you've kind of blown up that talking point. You said, I wasn't her doctor. It's abortion day. You walk into that room. What do you know about her? How well do you know her? Do you know her history well enough to avoid the complications that, thanks be to God, you avoided? Like, what's the relationship like? Do you know her name until you walk in the room? What do you know as you walk into that room?
Well, let me put it to you this way, Steve. Let's just say that your dinner is between you and your chef.
Okay.
But
well stated.
But I didn't tell you you're having dinner at McDonald's. All right? Now, you don't know who cooked the hamburger and you don't know who shoved it out of the window.
Sure.
Right? But you would know if you went to a fine dining restaurant. You might know who the chef is, etc. No, what we're dealing with.
I had dinner with you last night. You knew the
right.
The
waiter. You knew the waiter. Well, that's the way it is with abortion. Abortion is the McDonald's of medicine. You go, you drive in. Somebody might wait on the person. Some of these guys never even go in with the lady, and they come out as fast as they can, and it's not fast food, but it's fast medicine. They're kicked out, and they've gone through the drive-through, and that's the way it is. Now, where was the doctor and all that? Well, the same place where the person was flipping the burgers. They were in the back. They come out, and they throw the meat on there, and somebody puts a bun on it. The way it works, the reality of it, is that you always have at least 2 rooms running. One room where you're doing the procedure, and the other room where they've got a woman already prepped and ready to go. You never meet these patients. They have been consented. Their money is already taken. It's the only kind of medicine where you pay for your services in advance. Everything else, we paid for our meal after we ate it last night.
Yeah.
You pay for most services after you receive that particular service, but not with abortion. They pay, they get it done, you kick them out. So when you walk in that room, sometimes you don't even tell the poor young person your name. I'm Dr. So-and-so. Maybe you sit your butt down on the stool, you get the lady in the right position, and you start using those instruments, and in 10 minutes or less, you have the procedure going, and you don't even look back at the woman. They're now cleaning up the woman. They're going to put her in a recovery room where she never really recovers, particularly psychologically. You can have other complications. I'm on the highway after my last one. Do I care that there's a complication? No. That's part of what we call the abortion distortion, that itinerant, transient doctors can come to a particular area, do abortions, cause a complication. They tell the patient, oh, well, if you have a problem, you go to the emergency room. Now, if Dr. Johnson, my late wife, if she would have done surgery, had done a hysterectomy, and that sent a patient home, say at 2 or 3 days after that surgery, and that patient had a complication and she was not in town or had coverage for that, that would be called by the licensing board patient abandonment. They do not charge abortionists with abandonment.